Hi, my name is Morgan Stebbins. I'm a PN student at Wilson State College. And today I'll be showing you how to do passive range of motion, how to be ambulating your patient, and how to be transferring your patient. So before I even enter the room, I'll do hand hygiene, and I've already looked at my orders and I've looked at my patient's chart, and they have no contraindicating conditions that wouldn't make them able to ambulate or anything. So they are good to go, and I'm gonna go in there and see if she's okay to ambulate. Hi Shirley, my name's Morgan. How are you doing? Good? Okay, I'm just gonna verify with you. What is your date of birth? 4/03 of 1987. Perfect. And Shirley Cost? Perfect. How are you doing today, Shirley? Do you feel any nausea or dizzy? No? Okay. So if it's okay with you, we're gonna do some range of motion. Okay? That's okay with you? Okay, perfect. So for this demonstration, I'll only be showing you once, but in real life, you'd be doing it 5 to 10 times. But since we don't want to make the video too long, we'll only be doing it. So, Shirley, if you don't mind, I'm just gonna move your blanket a little bit over, still making sure you have privacy, and then I'm just gonna pull your rail down so I get a better gist of, there we go. Yay. Okay, Shirley, are you still doing okay? Perfect. So I'm gonna be supporting the joint, but we're gonna do abduction and adduction, and then we do supination and then pronation. And then you can't really show it on her, but this would be internal rotation and external rotation. How are you doing, Shirley? Doing good? And then lastly, we would do flexion. And then this would be extension, and then this would be hyperextension, if that makes sense. So flexion, extension, and then hyperextension. Are you still doing okay, Shirley? Good. Perfect. So I'm just going to move down to your leg, okay? So I'm going to try and keep Shirley as covered as possible. Okay, Shirley. So first we would do flexion, and then extension, and then we would do abduction, and then adduction. And if Shirley recently had a hip surgery, we wouldn't do adduction because that's crossing the middle line. So, and then we do internal rotation and external rotation. So that one. And then, if that makes sense, hopefully Shirley's demonstrating is better than mine. Okay, Shirley, are you still doing good? Perfect. So I'm just gonna come here and pull this back up. And then do you feel okay to have us move you? Okay, you do. So I'm gonna have my assistant or my coworker, Bryn, come over. And then Shirley, I'm just gonna be leaving this, pulling this just a little bit down. Perfect. We'll leave this there. Perfect. And then when me and Bryn do this, I will instruct her on the count of 3, so you can put down your rail now, Bryn. And we'll have our one foot pointed to the direction we're needing to go, and our one like this, and then we'll pull and go up. So I'm going to move Shirley's pillow, so Shirley, just excuse me. Okay, and then we're going to grab and get a good amount of towel. Okay. And then do you have a good grip, Bryn?
Yep.
Okay, perfect. So on the count of 3, we'll be moving her this way.
Okay.
Okay, 1, 2, 3. Perfect. Shirley, are you still doing okay? Yeah? Okay, good. So then for this, after we've moved Shirley, and then I'll place her pillow under her head so she's more comfortable. You doing okay? Perfect. I will have Bryn, I'm gonna move, Shirley, you're gonna go towards Bryn, okay? So we're just gonna do that so I can put some pillows under her back. So ready, 1, 2, 3. Perfect, thank you, Bryn. And then I'll just move this blanket just for video purposes so you can see what I'm doing. So I'm gonna put a pillow underneath. And then I would have her roll back, so you can roll her back, thank you. And then I'm gonna untuck her shoulder so there's no pressure. And then I would have her hold onto this pillow like this, if that makes sense. On the mannequin, it's harder to see because they can't really turn laterally, but for this demonstration, she'd be like this. Okay, Shirley, perfect, thank you. Okay, so now that we've done that, now we're gonna grab this pillow, and then I'm gonna have you turn over again just so I can get this one underneath you. So 1, 2, 3. Thank you. And then we're gonna let her back down. Shirley, are you doing okay? Perfect. So now I'm gonna be grabbing the pillow and then putting this under her arm. Then we'll pull down and show you this. So I'm just going to be placing this while supporting the joints under her legs. Going to make sure it's not pulling on her heels at all or any discomfort. Okay, so then Shirley would still lay there. Okay, Shirley. So, are you doing okay? Perfect. Okay. So Shirley would lay there, and I'd still have privacy. Just for video, I'm showing you a little bit more skin just so you can see where I'm exactly putting the pillows. Okay. Perfect, Shirley. So I'm gonna let this back up, and then we'll go like this. And then I'm just gonna scooch you a little bit over because I'm gonna bring the bed up and have Bren be my new patient. So here, let me just get her a little bit back there. Okay, perfect. So now, what I would do is I would have Shirley, I would assist her if we need be with the gate bell, and I would have her swing her legs over, and then I'd have her dangle them for about a minute, and then we'd see if she's dizzy or nauseous or anything, and then we'd reassess if so. So then I would put on her socks. And for demonstration purposes, we don't have them here today, but I'll just verbalize. So we put on her grippers just so for better stability when she's getting up. And then let me just put down my side rail because Bryn is going to be my new patient now. Okay, Bryn, you can come and take a seat. Okay, perfect. So your feet hit the ground, so that's good. Okay, perfect. So I'm going to get our wheelchair here. And then I'm gonna hit the brakes so it's stabilized for when you get in. Now, are you doing okay?
Mm-hmm.
Are you feeling dizzy or anything?
No, I'm good now.
Okay, perfect. So I'm gonna put this gate belt around you, okay?
Okay.
And then I'm just gonna put this under basically her breast, and then I'm gonna make sure it's about 3 fingers so it's not too tight, not too loose. I'm gonna tighten that a little bit. Perfect. And then when I help you assist in the wheelchair, when you feel the back bit, you can just sit down, okay?
Okay.
But we'll help, and then when you grab onto me, just grab onto my side arms right here, okay?
Okay.
And then we'll have our feet pointed, and we'll do this together, okay?
Okay.
Okay, so are you good?
Yeah.
Okay, perfect. So, on the count of 3, we're just gonna shuffle into the wheelchair, okay? 1, 2, 3. And then we'll just turn. And then once you feel the back of it, you take a seat down. Good. How are you doing?
Good.
Perfect. So do you feel okay to ambulate?
Yeah.
Take a couple steps? Okay,
Yeah.
cool. So we're gonna do basically the same exact thing we just did before.
Okay.
And I'll just come on behind the back side of you and help you take a couple steps.
Okay. Sounds good.
Okay. So you can grab a hold of me if need be. So 1, 2, 3. Just come over here. And then you can take a couple steps. If you feel dizzy or lightheaded, just let me know. And then you can turn around. And then do you want to sit in the chair or the bed?
The chair's fine.
Okay, so then we'll go back. And once you feel the back of it, just sit on down. Okay, perfect. How are you doing?
Good.
You're doing good?
Yeah.
Okay, do you need anything else for today?
No, I'm doing okay.
Okay, perfect. So I'm just gonna leave your call light right here and have you watch some TV or whatever you would like to do in your wheelchair. And then if you need me, just let me know.
Okay.
Do you want the door shut or the door closed?
The door opens, okay.
Okay, perfect. And then I would document, and then I would perform hand hygiene, and then that will be my skill for you. Thank you.